This is Module 1 for the 2017 July mid-year meeting, Focus on the Skin. This will begin our pre-work, so let's talk a little bit about our objectives and expectations as you begin your pre-work for the meeting. So the objectives of all the pre-work modules are to provide you with information to prepare us for the launch of AllCom when we get to the meeting. You are expected to view all the modules and understand and apply the content at the meeting. So what that means to you is we don't want you to merely just watch the videos and then, come to the meeting. We're really going to be doing it differently this time. So you're going to be getting the bulk of your information and all of the pre-work, and you're going to come to the meeting ready to rehearse, role play, and really be involved in learning to apply your information so you can get out there and really be successful with your launch of your new product. Your knowledge will be assessed upon your registration, so you won't be able to use your notes for your validation or assessment, but you can take as many notes as you need to as you watch the modules, rewatch them again, get a study buddy, do it together, quiz each other, but just remember you've got to be able to really apply the information when you get to the meeting. So let's get started laying our agenda. We're going to look at skin types versus skin conditions, inflammation, acute versus chronic, and we're really going to look at acne, adult acne, teen acne, and rosacea. And last but not least, we're really going to look at our focus of AllCom. So when we consider our type of skin, we are born with our skin type. Your genetics and your ethnicity do play a role, but your skin type can change as the years go by. The types include dry, normal, combination, and oily and sensitive. Sensitive can also be a condition. And I just like to give you a tip about when people say they have combination skin. That always used to kind of confuse me because I never really understood what that meant, and then I kind of got it. And what I found is a lot of people, especially women, don't like to say they have oily skin, and I don't know why, because it's such beautiful skin, and if you have oily skin or a lot of natural oils, as I like to call them, you're going to age much better. But that being said, if you do have those natural oils, you normally don't like them, so they kind of default to combination. So that means part of their skin feels oily to them and part of it feels dry. And what I have found in my clinical world is that normally, again, most of the time, I don't want to generalize, their overall skin might have a lot of natural oils, but the areas that are dry, they just might be drying it out with product. And if you look at the way we generally, especially women, put on product, we always go to our cheeks first. And I believe that's my theory. That's where a lot of the sensitivity is coming from. That's where we always slap on product first, is right on the cheeks. So what I do is I usually ask them, tell me about your skin when you were 16. And what I have found 9 times out of 10 is they'll tell me, oh, when I was 16, I had really oily skin and lots of blackheads, or I had pimples, so that gives me an idea of what I'm dealing with, but that's just a little tip. But your skin type is based on a couple things. How much oil is produced in your follicles from your sebaceous glands, and the amount of lipids found between your cells, or the lipids are also fats, oils. So dry skin, usually no oil. Dry skin people usually have really dry hair, dry nails. Their skin can look overtly flaky if they're not moisturizing or hydrating. And you can look at their hands, they might be itchy and flaky or tell you that they are, but these are the common characteristics. For those that have those beautiful natural oils, the characteristics are obviously excess oil, the pores are larger, they might have blackheads, whiteheads, and their skin might look thicker, but it's not. It's just that they've got more of a buildup because of the excess oil. So they've got to really make sure there's a sweet spot for both, all skin types. We all need to exfoliate. The problem is most people overdo it, and it's not really good for any skin type. Normal skin, think of a baby skin before puberty, a balance between the water and the oil. That's what normal means. They've got that balance. Normal size pores, usually no blemishes. Back to the combination, their water oil is out of balance. They've got that T-zone, which is considered the forehead, down the nose, the chin, and in that T-zone are the very large pores. Sensitive skin, again, can also be a condition, and it's becoming more and more common. It's usually very red or gets red easily, even, windburned easily. They might blush easily. Again, it can be getting red by products or the environment. Everyone thinks they're sensitive. I'm sensitive. So when somebody says that to me, I'll say, well, tell me a little bit about your sensitivities. What happens with products? Just so that I can get a better idea of what they're talking about. Or if someone says I'm allergic, I try to find out what happens. Do they get itchy? Do they get red? What does that mean to them? It's very important that your offices take a good medical history so they understand if the person is on medications, what they're working with. And when I'm doing lectures, I usually say, you know who your sensitive people are. They come in, they've got allergies, they've got dandruff, they're itching, they're on Allegra, Zyrtec, they're on, Xanax, they've just got sensitive skin. They might have some psoriasis or eczema. I mean, they'll tell you, and you can usually see that. But what you need to know is we've got to treat the skin really with kid gloves. They've got to be treated very gently. They've got a low tolerance to products, and they can't be excessively stimulated. So it's best to avoid a lot of heat and a lot of manipulation in the treatment room. So when we consider skin conditions, there's all types of things that really affect this internally and externally. So internally, again, diet, stress. If you're breathing, you're stressed. Dehydration. Externally, sun damage, of course, pollution, humidity, poor home care maintenance. And some examples are, and again, there's no coincidence here, what we're going to focus on for all-com is rosacea, acne, teen and adult, and we look at inflammatory, non-inflammatory, and post-procedure. So we're looking at the skin conditions that have, we look at sensitive, which can also be rosacea. They might have sensitized their skin, so it might be post-procedure. So we're looking at those chronic skin conditions of rosacea and acne, and then, there's some post-procedure. Sensitive. So let's take a quick look at inflammation. I'm going to keep it really, really simple. I'm not going to go down into the layers of the skin and what's happening with all the mediators. I'm just going to keep it real simple. When we think of something, when we think of inflammation, we think of something that's swollen. And that's the body's natural response to trauma. And trauma can be anything from a bug bite to a sunburn. That's when your body's been hurt, that's what your body does. That's normal. The difference between acute and chronic is acute is usually taken care of between 1 to 2 weeks. So you slam your finger in the door, it hurts, it's swollen, it's red. It's usually going to get it better in a couple weeks. If it doesn't, and you haven't gone to the doctor, you probably need to go to the doctor because your body's telling you that there's probably something a little bit more going on. Inflammation that's deemed chronic is usually longer than 2 weeks. If you're healthy and you've hurt yourself, whether you've cut yourself in the kitchen and you've gotten inflamed or whatever's happened to you, if you're healthy and don't have any other disease processes going on, everything should be taken care of in 2 weeks. That's what your body does. If it doesn't, something else is going on, and this is when there's a lot of things going on at a cellular level, and the inflammatory response is kicking in, and this is at a point where now there's a deeper injury or your body's gotten to a point where it can't turn it off. And when chronic inflammation is not taken care of, it can cause significant tissue damage. So we're going to be looking at those skin conditions, again, that are chronically inflamed. And we look at those symptoms of a chronically inflamed skin condition, and we're thinking of irritation, we're thinking of redness, and we're thinking of inflammation. And this is just an interesting fact just for you to know how many people and how much is out there for us to really help people with the launch of AllCalm. There's over 35 million Americans that spend over $2 billion a year to manage their symptoms of these inflammatory skin conditions. So think about what a difference we're going to make with AllCalm. So just a quick lesson here on Acne 101. If this hasn't been your challenge, you may not really understand acne. And again, we're not going to go super deep, but I want you to have a basic understanding of, what's happening underneath the skin when you see these things that are popping out on the surface. So on the top left-hand corner, you're seeing what normal looks like. So you've got the top of your skin, you've got your hair follicle. You can see where it starts here at the base. You've got your sebaceous gland, which is characterized in this picture by this kind of brown sac. And what's in this sac is your oil, or what they call sebum. And that's all natural. That's what's supposed to be happening at, underneath the skin in the hair follicle. So when you move to the next picture and you look at the blackhead, we've got some excess sebum, and the cells are sloughing into the follicle and they've gotten plugged. And the reason it turns black is because it's exposed to the air, it becomes oxidized, and you see that black thing on the top of the surface, and those can usually be expressed out fairly easily. But again, you need to do it correctly so you don't cause any harm to the skin. What happens next is a whitehead, which is actually staying below the surface. There's actually a layer of skin on top of that. The other word you might hear for whiteheads is milia, and those really have to be taken out with someone that knows what they're doing, because they actually have to go in with the tip of a needle and kind of open up that skin on the top so they can get out that plugged conglomeration of sebum and skin cells. So you don't want to sit there and push and push and push, because it's not going to come out, and you're going to end up damaging that sebaceous gland sac underneath the skin. And that's why you have to be really careful when you're popping a pimple, because this sac is very, very fragile. And if you cause too much pushing, as we're going to see, that will burst underneath the skin, and that's when infection sets in. So now we come to the papule. You may have or may not have had one of these in your lifetime. It's usually a small inflamed bump. It's red, and again, there's more sebum, there's skin cells, and now there's some underneath that you're seeing the white, which is white blood cells, or we call it pus. And the white blood cells come because there's something going on. They're trying to fight off a foreign invader. That's what your white blood cells do. And when they all come together as a team, they get together and they look like pus. It is pus and it looks gross, but that's what your body's doing. But on the surface, it looks like a red bump, but there's stuff going on underneath the skin. So that's what I want you to pay attention to, the inflammation that's happening underneath the skin. And now we're starting to see some redness as we go into the papule and now the pustule. So the pustule is what we call a pimple, and it's, again, red and inflamed, but now we've got that whitehead on the top. And that's when people really start to go to town and start pushing and popping, which can be not a good thing, so you've got to be careful. But again, you can see it's really starting to get angry underneath the skin. You've got that inflammation, and again, that's what we're going to be helping with our product. Now we're going to get to the cystic nodule, and these are always really challenging because they usually show up on the top of the skin as just like a red hump. They may or may not have a little baby head on them, but what's going on underneath is crazy, and they're very, very painful. And what's happened here is, whether usually they've tried to pop them or not, there's so much, there's a lot of oils and excess skin cells, and now the body sees it as a giant foreign invader. A lot of white blood cells have come to the area, and the sac is popped. So you can see how this actual sebaceous gland has exploded, and now it's into the tissues of the skin. So now there's going to be tissue damage, there's redness, there's inflammation, and there could be infection. So that's kind of your one-on-one on acne, just so that you understand what's happening underneath the skin when you can't really see a lot on the outside. So teen versus adult, and they do show up differently. Maybe this has or has not been your issue. So teen acne comes usually all over the face. It'll usually resolve when they're kind of getting out of puberty. Most of the time, but then again, unfortunately, it can resurrect itself again. Or what we're also finding is people that have never had acne are having adult acne. And for adult acne, it's showing up on the chin, the lower part of the face. That tells us that hormones and stress are causing this to happen. And then also what happens as an adult, this is going to be the time in their life around 30 when that rosacea can also start to show up. So they're getting a, kind of almost a double or triple whammy. So because adults have different type of skin, the things that they're trying are usually not really helping, and they're probably doing more harm than good. So a little bit different on the presentation here, and if you look at these pictures, these are really good depictions of how each shows up. Now, interestingly enough, when you look at your literature, when you're reading adult acne, they say 25 or older, but insurance considers adult acne 18 or over. So with some treatments in the office, teenage acne has to be under 18, and there's some things that the insurance will reimburse for, but not to confuse you. Again, if you get on acne.org, they consider adult acne flare-ups 25 and older, but insurance sees it differently. So again, just a little tidbit there for you. So once they do get into the physician's office, they can't take it anymore, they can't figure it out, they've tried everything that they can get their hands on. This is how the doctor's mentality usually approaches this when they start to see the acne. So whether it's teen or adult, this is where they're going to go. So first 3 months, they're going to start with these types of things. Next 3 months, if they're still not seeing results, they're going to head into maybe something oral, whether it's an antibiotic or an anti-androgen, which works on the hormones. If they're a female, they might try birth control, some peels. A Clear and Brilliant is a very light laser that is a light Fraxel laser, and they might try that type of laser in the office. And at the 6-month mark, if they're still not really getting any results, and they have and this is where it gets kind of serious, they'll have that discussion with the patient or the patient and the parents. They might try them on a course of Accutane. But herein lies the issue: compliance with staying on treatment, and then the tolerability of the treatment. So even things like antibiotics, birth control pills, peels, you can see that it's very, very hard to tolerate a lot of these things. And then Accutane's a whole nother discussion we'll get into later. So staying compliant and tolerating these things, it's just very challenging to help manage the symptoms of these chronic conditions. So moving on to rosacea, it's still kind of considered what I call one of the 8th wonders of the world. We're still not really sure why or how it gets started, but science is still working on it and uncovering some key factors that are contributing to the redness. So that's what we're going to be focusing on. We can't change the cause. We don't even really know the cause. There's a lot of theories. There's a lot of papers being written, a lot of hypotheses. Rosacea.org is a great resource. I get on there all the time. So things are changing constantly. So I recommend you get on that and look at it regularly to see what's updating with rosacea. So let's look quickly at the 4 subtypes. The first one is really just the red broken capillaries. That's that crazy long word that no one can pronounce. So for short, they call it ETR. But if you break down the word, it's erythema, which means red, and telangiectasias, which are broken capillaries, so red broken capillaries. So the flushing, and you can tell along with that, there is some inflammation. So it's very visible. The capillaries are dilated, so they're always flushed. The second subtype is papulopustular rosacea. This is where they start to get some of those pimples. So again, the redness, the swelling, and some of the breakouts that we just talked about. The phimosis rosacea is where they get, now their skin is really changing. They get that red, bumpy, thick, usually you'll see it like a bulbous nose. You'll hear that terminology. It might go onto the cheeks, but it has a bumpy texture. That is a form, and the third subtype of rosacea. Fortis ocular, where the eyes are red, they're always red. The eyelids can be swollen, they can be peeling, and they might get what looks like a sty. And it's right here on his right eye in the corner, and it's not really a sty, but that's what it looks like. So they might have like a bump there. So this is a busy slide, but what I want you to take away from addressable rosacea factors, what are the factors that we can address? So if you look at the left side, we look at the innate. Innate means what just happens normally, how your immune system responds to things. Remember I told you, we can't change the cause. We can't address the cause. So we can't address the immune system. We're not addressing the neurovascular system or the microbes, but we are addressing the factors, the symptoms, the inflammation, the irritation, the dilation, the things that are, over-dilated or, they're vasodilated is the term you'll hear. And then the irritation of these mites on the skin. So when you do your own reading and research, what you'll know is we all of us have these Demodex mites near our hair follicles. We all have some little creatures on us. But what they are finding is the people that have rosacea carry more of these. So we want to help, calm down the irritation from these microbes. So that's what we're going to be doing with AllCalm. We're going to be helping to manage the addressable rosacea factors. Everything on the right here. So let's take a look at the typical rosacea treatment approach. Again, looking at the first 3 months, they finally have gotten into the doctor. Everyone has rosacea these days. They've got to get to the doctor. They've got to get formally diagnosed so they can be properly treated. They're putting a lot of things on their skin that aren't helping, and like I said earlier, making it a lot worse. So they'll put them on a gentle cleanser. Remember, everything's gentle. A mild moisturizer. Remember, sun is the #1 trigger. They've got to get them on an SPF. And they should get them on a physical SPF, not a chemical, because remember, everything irritates their skin. They're very sensitive. And then some of the more common topical prescriptions, so RX means prescription if you're not familiar, Metrogel, Finacea, and Soolantra. If that's not getting them anywhere, they'll, in the next 3 months, possibly start them on an oral antibiotic and start maybe with some IPL or BBL laser treatments to help with the flushing and the redness. And again, probably no secret here, it's the compliance of these treatments and the tolerability, which is always a challenge when something's chronic. And again, because they're so sensitive, it's just very challenging. So our focus with AllCalm, we're going to be focusing on that inflammation and the redness as it relates to the skin conditions of acne, adult acne, rosacea, all being sensitive skin. That's where we're focusing. With all of these skin conditions, redness and inflammation are an issue. So, up next, we're going to continue to build on our foundation and take a look at understanding how the market addresses these conditions.